So Rob, do you want to introduce yourself?
Thank you, Emma. Good morning, everybody. It's Rob Simcox here, Director of People, and delighted to be with you all on this Wednesday morning. Thank you, Emma.
Sally?
Morning, everyone. I'm Sally Palmer, Nurse Consultant for Infection Control.
Thanks, Sally. Phil?
Morning, everyone. Phil Bolton, Chief Nurse. 4th week with you, so it's really good to be back on this call talking to you.
Brilliant. Thanks, everyone. So we've got quite a jam-packed session this morning. Importantly, but first of all, I want to start by just saying a massive thank you, and I'm sure we all join in on that, to every colleague that's working in Sherwood at the moment. Across all of our sites, we know that the demand on our services for a number of weeks now has been quite relentless at times, and today is no different to that. And colleagues are under an immense amount of strain in treating patients in a timely, safe way. So I just want to say a massive thank you to everyone who's going above and beyond, as always, in Sherwood. There's some remarkable stories that I've seen around what some of our colleagues have done, whether it's getting a patient all the way back to Manchester, or whether it's just about taking care of someone safely in one of our urgent care departments and centres. So massive thank you for what everybody's doing at the moment, and we hope that over the coming weeks we may get some respite, fingers crossed, but thank you, and we do appreciate it. So today we've got a number of updates to share with colleagues, and I'm going to share 2 or 3 really important ones for us. Then we're also going to hand over to Phil and Sally, who's going to give us an update with regards COVID, specifically across all of our sites, and also a reminder, an update with regards keeping each other safe during this time, colleagues and patients, and some of the measures that we've introduced to do that. So important that we all do take note of that. And then the second half of the session is going to be sharing the exciting news of our launch of the new People, Culture and Improvement Strategy, which we have been sending out bits of information over the last couple of weeks, and then there'll be much more learning today and then over the coming weeks on that. So Rob and I will share a little bit more insight on what that means to you, our colleagues working across Sherwood Forest hospitals. So what I first of all want to start with is recognising that next week, next Tuesday, it's the NHS birthday, and that's Tuesday the 5th of July. And some of us will be doing celebrations in our own departments and teams, and we'll also be recognising NHS Birthday as an organisation. So please keep your eye out for news and bulletins with regards to NHS Birthday. And I think it's just an opportunity really for us all to be proud of working in the NHS. We know that, yes, it can be challenging at times and very testing, but at the same time, it can be very rewarding, satisfying, and we all know that we are making a difference for the people who live in our community. So let's celebrate NHS Birthday next Tuesday, the 5th of July. And if you are doing anything in your own areas, sites, teams, and particularly, you know, those working across our community as well, who are out and about every day, share some posts, whether it's tweets, Facebooks, of what you're doing to celebrate the NHS Birthday. Also, starting this week, really it's our Pride month. So 1st of July marks the month for Pride, and we always celebrate Pride in Sherwood, and we have undertaken on the 26th and also the 28th of July Pride walk and celebrations on our Newark site and Kingsmill Hospital site. So please make a marker in your diaries for those. Myself, I've been part of the marches every last 2 or 3 years more so, and it's always a really enjoyable and celebratory time. So please do get involved in that. And as always, let's celebrate by raising the flags. Some great dressing up involved as well, but the whole of July is celebrating Pride Month. So please do get involved and support your colleagues in celebrating and recognising again the diversity that we have in Sherwood. Thank you. And finally, I also want to mention in Sherwood, we're always really keen to keep listening, understanding and learning as an organisation, and part of that is about how we engage with each other, and a mechanism of engaging and sharing what's going well and not so well is through our Freedom to Speak Up route. And I'm really pleased to say that we've recruited further champions in Freedom to Speak Up across the organisation, and this means that supporting our guardian and colleagues and teams is people you can turn to have a conversation. And again, share something that may be difficult to either share with your line manager or someone else, or simply speak to one of our champions or the guardian with regards signposting and where I need to go next. So just wanted to say thank you to every Freedom to Speak Up champion in the organisation. And if you do want to get involved, then get in touch with Kerry Bosworth, our Freedom to Speak Up guardian, about becoming a champion. If anything else, it helps improve your skills with regards how you can help people with a difficulty or a challenge, and manage that emotionally and signpost appropriately. So please do get involved, and thank you to everyone who's recently become a champion. It's a great thing for Sherwood, and I think the more champions we have, the better. So those are just 2 or 3 things I wanted to highlight happening as a trust. So celebrating NHS birthday next Tuesday. It's the start of Pride Month, which is this Friday, the 1st of July. And we've got a couple of Pride marches planned in the 26th and 28th of July. And then also saying a big thank you and celebrating, hopefully it's strengthening our Freedom to Speak Up culture in the organisation by recruiting further champions. So thank you. And if we get any questions on any of those, we will pick them up as we go. Now, I open today by recognising and saying a massive thank you to everyone in the organisation at the moment for responding to the demands. And what we've also seen is an increase in COVID. And I'm going to hand over to Phil and Sally now, who's just going to give us a little bit more insight into what those pressures mean and we're all seeing as an organisation, and what we may have reintroduced to help us all keep safe during this difficult time. So Phil and Sally, if I may hand over to you, and then if I get any questions from anyone, I'll get back in touch. Thank you.
Thanks, Emma. Thanks for some good messages in there, and yeah, really glad to have some time with you today, as I said earlier. I think it's really important that we have a discussion around why we reintroduced mask wearing, and I wanted to come today and have that conversation. Really glad Sally's joined me to make sure that I tell you the facts correctly as our expert, so we'll certainly bring Sally in on that. So if we think back a couple of weeks, we made the decision based on the science at the time and the evidence and the guidance we were given nationally to look at how we could reduce mask wearing in the organisation, and I think it was the right thing to do. I think it gave me a real boost, really positive feedback. Being new in the organisation, it gave me a chance to see people's faces, which was certainly positive, and enabled me to recognise people. So it's certainly the right thing to do, but we're really clear at that stage that we needed to track this carefully. And if at any time we had concerns or thought we needed to revert the decision, then we would. And unfortunately, we're faced with that decision this week. And I think it's the right decision at present, and it's based on a number of factors or triggers. We've seen a 50% increase in patients getting nosocomial infection, which means patient-to-patient transmission of COVID in our care. So that's not people coming in with it. So that's something we really need to take note of. I think we're seeing a significant increase in staff absence, and Rob will be able to give us some figures later if needed, but an increase in COVID absence. And we've seen some outbreaks in teams, and not just clinical teams. We've seen whole teams being decimated, where 6 to 7 people have had to go off with COVID, which has caused a real risk to services or inability to run services for our patients. So they're all together, those triggers made us think we need to act on this and try and put a halt on that. And I think Emma's point was really clear. This is all about how do we keep our patients safe and how do we keep each other and you safe. And they're the 2 most important things for me. And the other stuff we'll have to work through and have our own opinions and discuss and debate, but I'm not prepared to compromise on the safety of our patients or of you and our colleagues. And we need to be able to keep our services running. So sadly, that's why we've done that. I've been really impressed with the feedback so far, nobody's really challenged it. Yeah, people are disappointed. It's equally challenging when, you know, we can go to the pub and we can go to Glastonbury or we can go to a concert and we don't have to wear masks. We understand that. And we know, you know, that feels a bit inconsistent at time, but our patients are more vulnerable than the general public. And, you know, where even if we're not directly patient facing, we're working in an organisation and, you know, we can all contribute negatively or positively to that. So I think it's the right thing to do. So I just wanted to come and front that, explain to you why we took that decision. We'll continue to review it regularly. None of us know which way this is going to go, but if we can keep it under control and be proactive, then for me that's the right thing. Sally, as the IPC lead and expert, is there anything you want to sort of add or reinforce?
I think it is like you say, we are seeing the numbers increase, and that's not just within our organisation. So other organisations are seeing the same increase, and where they've made the same changes as we have. We know regionally that they're putting measures back in place. So it's not something that's just you know, within our organisation. It is out in the community seeing increases. All healthcare facilities are starting to feel that and see impacts for patients and their colleagues as well.
I think one of the risks when we reduce mask wearing, and I reflect on myself personally, if you're not careful, you relax all the other things without thinking about it, you know. So all of a sudden you might not social distance as much as you should be doing. That then without a mask adds a risk. So I've had to challenge myself on that. And then we're still doing our regular testing twice a week, and you know, we're all human and we're all busy and we're all sick to death of this, aren't we? And bored, and it's repetitive. So I think it's just about reinforcing those really simple messages that we've all driven, you know, the face space, masks, hand hygiene. They are the fundamental things that we know work. So my plea to you will be challenge yourselves, challenge each other. I'm happy to be challenged and prompted. With my memory, I'm grateful when people prompt me or prod me, or you know, it's easy to walk out without your mask on, particularly now. So you know, let's challenge each other and deal with this collectively would be my plea and ask. And that's what you do well in this organisation. You know, walking around today, everyone had the masks on. It's good to see the volunteers at the front door. Tracy Bass and the team mobilise them quickly to support. You know, reinforcing the changing message. So really grateful to Tracy and the volunteers. And the way that you've all led and driven this in your teams and departments. So massive thank you. And I think, Emma, if we pause here, you're happy for us to take any questions on those elements if people have any.
So one question has come through just now. Do we know which cohort can have the spring summer boosters? That's just been taken off. Apologies. So the question just came through. I think it was relating to the spring booster. Emma,
I didn't know if we'd come in on a couple of bits, if that's all right, whilst we're just working through possible chat. So I'll touch on booster and some of that detail is being worked through. One thing that is strongly likely is that colleagues at Sherwood will get access to a booster vaccine this autumn. That will be something that's available on site in our dedicated hospital hub. The timescales of when that will be available are a little unclear at the moment, but certainly what I will commit to is once that detail is clearer, we can share some of that news through this forum, Emma, and I think it'd be really key. I'd be really keen to do so. I also thought it'd be worth touching on that, you know, as much as we're starting to see, you know, greater prevalence of confirmed COVID cases in our workforce at the moment, I want to just remind individuals you can still get that PCR test.
Yeah.
You know, if you think you've developed symptoms, or touching on what Phil had shared around, you've done your twice weekly lateral flow and you've seen that second line, you know, we're here to support you and offer that reassurance. The number is 0115 883 4640, and I know a conversation that we often have. We'll make sure that's communicated in this week's bulletin. If in doubt, you can get through switchboard, so you just ring the main hospital. Might take a little longer, but I appreciate that there was quite a number of digits I shared there.
Yeah,
but the message remains. You know, you can get a PCR at Sherwood, and that's not changed. Just to provide that reassurance.
Thank you. Thanks, Rob. I think it's important just to reiterate that that is available, can be accessed for colleagues. Just a couple. One is a comment personally expressing out they're actually pleased with regards to the reintroduction of masks, whether that's because it's clinically vulnerable or just for peace of mind. So I think there's some positive feedback there. There's a question with regards do you have the answer to this? Has there been a change in policy regarding pregnant colleagues needing to work from home after 28 weeks? Do we have an answer to that one, or maybe we could get back to the individual outside?
Been no change to that, unless Rob, I don't know if you want to add.
No, there's been no change.
No
what
change.
I'll complement with that is obviously these are individual risk assessments, very much a person-centred approach. I think where the individual may suggest there's greater risk, or what adjustments may be able to put in place for the individual to continue to contribute. My advice in regards to that particular question, you know, again, we're here to help. So if you want to contact me personally, I'm happy to do so. And then I can point you in the right direction of where you can get some advice from one of the team. So my email address is robert.simcox@nhs.net. Just drop me a line and we can work through the detail.
Thank you, Rob.
I think just to reinforce that bit on policy, Emma, I think the only thing that's changed at the moment is the reintroduction of mask wearing. So everything else remains the same, but it's a bit about reminding and reinforcing the stuff that we hadn't changed that had maybe dropped off. So the only change is the mask wearing. Things may, but we'll keep you updated and engaged in that.
Okay, that's fine. Thank you very much. With regard, so there was one saying, aren't the PCR tests just for staff in outbreak areas? And I think we've confirmed it's not just for staff in outbreak, it's for everybody, isn't it, Sally? You're nodding.
So we have said you don't have to have a confirmation test by PCR. You know that we will take the lateral flow. So we don't have to have that test. But for outbreaks, yes, absolutely, we will be asking staff in that area to have a PCR test, and we will help to arrange those as well.
Okay, that's helpful. Thank you. And then there's a further question with regards to the current numbers of patients with COVID. And particularly with that, which of that proportion of those patients have symptoms or serious symptoms, as in critical care? So I suppose are we seeing a significant increase in critical care needs of patients due to COVID?
So as of today, we've got 2 patients in critical care due to COVID that are COVID positive. We haven't had any patients in critical care for several weeks, and in just over a week and a half, we've gone from sort of 15 positive patients to 42 that are coming in, again, a mix of symptoms and asymptomatic.
Thank you, Sally. And I think that, if anything, just reinforces the reasoning of why we need to keep each other safe. One, all colleagues in the organisation, and equally our patients. That's always our utmost concern, is about keeping people safe at work to be able to take care of those in need. So I think it just, if anything, reinforces why masks have been reintroduced. And also, I'm very mindful, and I'm sure others are, we're not the only trust that's doing this. It's occurring across our region and nationally, because we think it's the safest thing for everyone involved right now. So thank you for that, Sally. Unfortunately, it appears that some colleagues were sent the incorrect link for the staff brief today. So just very quickly, we introduced today covering off 2 or 3 areas for everyone in the trust to be aware of, which is around celebrating the NHS birthday next Tuesday, the 5th of July. We also wanted colleagues to be aware that this Friday marks the Pride Month, and we're particularly celebrating that across Sherwood and Nottinghamshire as a wide, and we have some Pride March events taking place on the 26th and 28th of July on Newark and Kings Mill site. And then the further update was regarding recruiting of further Freedom to Speak Up champions in the organisation. Again, just one of many routes where people can engage and have a voice and share with us what works well and what doesn't work so well, and then hopefully we can keep improving together. And then finally, if you did just miss the start of it, Sally and Phil was kindly giving us an insight and an update into our current position as an organisation in relation to the demand on health and care, and also the significant increase in COVID patients. I think Sally just shared we've gone from around under 15 patients to now almost 50 patients in the space of 7 to 10 days. So quite significant, and some of the reminders and reasoning for reintroducing face masks. So that's just for those colleagues who missed the start, and our apologies for sending the wrong link out. It's a learning and we'll get that right for future. I wondered why there were not many attendees on when we started. I wondered if it's because I was chairing this week's staff brief or not, but I can see we've got just under 100 of you now, so I won't take that personally anymore. But thank you for those colleagues who pointed that out, and we'll rectify that for future.
Emma, I didn't know if I'd perhaps come in to just put a bit of context around the impact it's having on our workforce at the moment.
Yeah, that'd be good.
So thanks, Sally, for sharing some of our patient kind of numbers. It's a similar picture. We've seen an increase of nearly 60% in absence related. This is head counts of individuals having precautionary absence now because of COVID. So a few weeks ago, we were probably on a given day having around 30 to 40 people off with COVID related absence. As it stands today, that's just under 100. And that's changed very quickly. It's been quite a rapid increase. Now you put that into overall kind of absence at the moment, we're still kind of at what I'd describe kind of a seasonal level where we see things reduce at this time of the year. But I think it's worth just reinforcing those key messages Phil described about challenging us all just to, safe space, hands, in regards to those really good practices that we all adhere to. And I appreciate we've been adhering to these for a couple of years now, but it's the route to kind of tackle this virus, that kind of safe measures, those precautionary methods that I know everyone was so strict in following. So it's just a careful reminder. Let's take the opportunity to go back to what we were good at.
Thank you. Thanks for that, Rob. And I think it's always helpful sometimes just to quantify the scale of the impact at the moment, rather than just saying it's busy or we're on Opal 3 or 4. Actually, sometimes just quantifying that further does put it into perspective. So thanks, Rob, for sharing that. I have got a question in relation to the change in the reintroduction of masks. And this is specifically to, obviously, Sherwood guidance has changed as of yesterday. Is that based on any change in national guidance that we're building on, or purely a Sherwood decision?
So,
oh, Phil, you're on mute.
Sorry, done well until then, haven't I? Thank you, and Sally, feel free to join in. But a lot of the national guidance, it's guidance, but what it encourages you to do is make local decisions based on local factors, which is the things we described. So that's pretty much the national guidance. Yeah, there's a drive to try and remove masks, remove social distancing when the time's right. So that sounds a bit woolly, but that's the guidance, and that's what we're going to do. Yeah, it's good to see what other people are doing and benchmark and try and do collective decisions where appropriate, but we're going to do what's right for Sherwood and us and our patients.
Thank you. Thanks for that, Phil. And I think if anything, that, I don't know, for me, it's like not every trust is the same, is it? And not every region is the same. Some trusts in regions might not be seeing as much of an increase as what Sherwood is. Therefore, not always one size fits all, but we need to go on a level of intelligence that informs us to say what is the safest thing for us right now, and I feel that that's what we have done as an organisation. So thank you. Thanks for explaining as well, Phil. We've not got any more questions that are specifically coming through with regards reintroduction of face masks. If there is any literature out there that people see in areas where we did stand them down, either remove that if you could for now, or let us know if there's something digitally we can remove. We think we've now removed most of or all of the digital displays of wearing face masks with the reintroduction. But if you do see anything, then just be assured that we have reintroduced face masks from yesterday, and that will be as it stands going forward for now. So thank you for that. And then obviously just to say that we do record all of our staff briefs, so you can go back and watch again to get insights into what's happening in the organisation. And equally, we have the contact details and information in there as well of what we've shared. So you can dial back in again and get this recording, and it'll go out in our bulletin. So that's just a reminder from that point of view. Now, I don't have any more questions that have come through. So Phil, Sally, you may just want to hang on for the last 10-15 minutes in case we do get any more, and then at least we can field them to you while it's opportunistic. So thank you very much for that, and thank you for everyone's questions as well. Some really good questions in there and important ones to ask. So thank you for popping those in. So we're now going to move on to the last bit really of today's staff brief, and it's really sharing the new people, culture and improvement strategy that we've launched in the organisation. And we just want to share a few headlines about that. And do not worry, it will not be death by PowerPoint in any form whatsoever. But we have got a few slides that I'll just share, and then colleagues can have a little bit more insight into what the strategy is about. So hopefully you can all see that on your screens. So what Rob and I are here for is to share a little bit more around, so what does that mean? You know, fancy words, the name strategy, what does it mean to me as a colleague working in Sherwood Forest Hospitals? And our strategy is really underpinned by a key objective of ours in Sherwood, which is helping our people to be the best they can be. And that is about helping you turn up to work and enjoy your job, feel developed, nurtured and supported in your role, feel safe and feel like you belong and are part of the organisation, and that you're given opportunities to develop and thrive in Sherwood as well. But part of that is about taking care of you, your well-being and welfare. And we believe that all of those things together really does try to do our best to ensure that people can be the best that they can be in their role. And we think by doing that, then we will equally carry on delivering outstanding quality care for our patients. Now, our ultimate vision really is that we always say it's about Sherwood being a great place to work and a great place to belong in terms of our colleagues. And underpinning all of that are our care values. And that is about us being kind to each other, respecting and caring for each other, ensuring that we are an inclusive organisation and we celebrate the richness and the diversity of Sherwood and all that that brings in terms of working alongside a colleague, but taking care of patients as well. And like I said, an important part is about how we engage with each other, how we listen, how we learn, how we interact with each other, and creating that culture of safety, trust and learning. And these are really all of the threads that run throughout our strategy, or we feel that it does. Living our values, underpinning our values and helping us achieve our direct objectives as an organisation. And we've gone through quite a large engagement exercise in putting this together. So we've been to many forums, groups, professional groups, We've interacted and engaged with in many areas, clinical, non-clinical, support services, and because we really wanted the strategy to mean something to people and for it to have in there things that matters to you. And these are the 4 delivery pillars that we have in the strategy. And we're going to just take a few, 2 or 3 of these and share a little bit more about what they mean. What does that entail? What does that matter to me and my role, and how is that going to make a difference to me and the people that I care for across Sherwood Forest hospitals? But those 4 pillars are really about looking after our people, and really that is about creating a safe, healthy environment, one where we take care of your physical, mental needs, that we give you support, and that we treat each other with respect and kindness. It's also about feeling like we belong in the NHS and we belong in Sherwood. And that comes back to being an inclusive organisation, one that's very respectful of the diversity that we have in the organisation and the rich brings. But part of that is also about growing for our future. We know that recruiting talent, nurturing and growing talent, these are areas we recognise that we need to keep improving in. And therefore we will have a large focus on recruitment, retention, learning, education, and developing and nurturing the talent, as well as attracting talent to Sherwood. And through that, we hope to keep improving as an organisation and looking at new ways to deliver the care that we provide by empowering colleagues to have a go at an improvement, implement a new idea and initiative. But let's do that in a helpful, supportive, safe way. So these are the 4 delivery pillars that we will keep holding ourselves to account on, and we want you all to be involved in and challenge us on, are we doing what we say we're going to do? And these are the things that we truly do believe will help our people, you, be the best that you can be at work and across Sherwood Forest hospitals. Now, all of those 4 pillars do link back to our strategic objectives, whether it's about continuing to provide outstanding care, whether it's about supporting your health and well-being. It's about we're an organisation where we're always eager to learn and we always want to keep improving. And I think the demonstrable work that's been done over the last number of years truly demonstrates that. But let's keep doing it and let's keep focusing on improving for each other and also our patients. And let's ensure that every penny that we spend, that we are efficient in what we do, so we make best value of the money that we do have, whether that's through workforce, whether that's bringing in new innovations, technology, digital solutions, or whether it's about capital and building new areas, new sites, new facilities. But we believe that underpinning this will be our people, culture and improvement strategy as a key enabler to help you and us to keep delivering and improving together. So this is how all of our pillars link back to our Sherwood priorities. And what we've put in the strategy, sometimes it's not easy to know. So who are the key leaders who lead the teams? But importantly, then you can get in touch with all of the teams that do the work on the ground every day, day in, day out. And here you've got our leadership team working across people, culture and improvement. And this is a new strategy for Sherwood. We've never had a joint strategy such as this before. And I think, again, this demonstrates the collaboration that we have across people, culture and improvement professionals, experts and advocates to help us keep improving as an organisation. Here are all of our contact details, and we will share information about the strategy afterwards, and that could be available in the links. We want you to get involved. We want you to keep helping us, hold the mirror up. Are we delivering what we say we are? Do we need you involved in some of these things? Absolutely, yes, we do. And many colleagues are actively involved in many of the initiatives that we have in the organisation, whether it's through groups that are working on recruitment, retention, whether it's about those that turn up on a regular basis to the Culture Collaborative and many, many other forums that we have in place. Please do keep helping us make sure we're a great place to work, belong and receive care. So that's kind of an intro into our strategy, and then Rob's going to share a little bit more about his thoughts. And obviously Rob is now our new Director of People, and he's leading the whole People Directorate and team, and Rob and I work very closely together. But Rob, do you want to share a little bit more about what this strategy means for you, our teams, our colleagues in the organisation, and what we might see over the next number of weeks regarding the strategy itself?
Thank you, Emma. You know, I'm very humble to be on Team Brief today, and very proud of the document that's been co-curated over the last few months. There's been that collaboration Emma's described with colleagues across that People, Culture and Improvement umbrella, and it's a framework. It's a framework for us to measure success with, but also challenge ourselves of what we want to provide to you, our people, that provide safe, effective patient care day in, day out. The plans over the next few weeks are starting to socialise this more, but more importantly, the wider leadership team having an opportunity to describe to you all what does it mean by looking after our people. What does it mean by growing for the future? And actually starting to go into a little bit more detail about what that will look and feel like. We've got a variety of metrics and indicators that underpin all of this that gives us an indication of, are we achieving what we aspire to achieve? You know, often strategy documents can be documents that gather dust on shelves. What we want to do is this to be meaningful and have some impact. I'd be the first to admit we can always do more in regards to engaging and socialising with people, and today is one of the steps on that journey. But I would encourage you all on the call today, and for those that are listening to this on catch up, so to speak, we're here to listen. We want this to be right for you, and we want this to be inclusive and a true representation of how we can make impact over the next 2 to 3 years. So I'll pause there, Emma, and I'm conscious, wanted to give a bit more time before we wrap up for any final questions as we're starting to get towards the end of today's staff brief.
Thank you. Right, thanks, Rob. There's no questions that have come through as yet. I think I would reiterate that from what Rob shared, really, and I think is a key factor to this, is that the only way that we can keep delivering the care that we do to the standard that we aspire to is from what you all do, and I see day in, day out, is continuing to engage with each other, continuing to bring your ideas for improvement forward, to have an appetite to develop, but importantly for us all to keep continuing to take care of each other. And part of that is about living our values, being kind, respectful, caring for each other. And sometimes just saying, how are you? How are you feeling? Do you need any help, support? What can I do for you? And I think really it is about continuing to grow our leaders in the organisation to have that leadership style, approach and attitude, and to actually nurture and develop those around them to be the best that they can be. So I think the more that you can get involved in helping us keep improving, and part of that will be through some of the initiatives. I mean, a key one we identified, and following feedback from the staff survey, was about how we recognise and reward colleagues in the organisation. And I think, again, we'd all equally agree that there's more that we can do there. And we need to get back to the basics and get them right. And let's recognise the roles that you all do. Let's celebrate that, appreciate it and reward you for that. Now, we can't always do everything and we can't always say yes to everything, but we can keep raising it as an idea and an opportunity to improve. And I think the more that you're involved in that, the better for me, because I think you count. You absolutely count, and your voice counts, because that is what helps us keep delivering great patient care. So please do all get involved, and if there's any areas within our people, culture and improvement strategy that you're particularly interested in, then please do get in touch with myself, emma.challans@nhs.net, or with Rob or any other members of the team that you've seen or you get names of from when we share the strategy and the link afterwards. And we really love you to get involved in some of these key initiatives, and I'm sure for some of you it may be a mini project idea or other, but really welcome that involvement. Okay, so I'm just gonna we've got about 3 or 4 minutes left, and Phil and Sally, do you just want to kind of recap or reaffirm anything with regards recent COVID and reintroduction of face masks at the moment?
Yeah, thank you. I'll try and keep it really simple as I am. Really, we thank you for your response and the way you've already reacted to this change. So what we're asking you to do is thank you for wearing your masks. We've explained the reasons why we need to do that. We'll continue to review that and ask to keep our patients safe and you as our workforce and staff safe and able to work and deliver our services. And then that bit about challenge each other, challenge ourselves to do the things we've been doing for the last 2 years that we know worked. The face space, mask, hand hygiene. It's worked for 2 years. Let's not throw it away. And hopefully we can get this under control and continue to move forward positively.
Thank you, Phil. Sally, is there anything you'd like to close off with?
I think it's just from our team point of view, from infection control. Thank you for all the engagement that you have with the team. It's really important that we have those good relationships with yourselves out there, and we're always here. We're here 7 days a week, so if you do need us, please do give us a ring.
Thank you. And I know sometimes, Sally and the team, it's a difficult job that you've got, and some people will be in favour of reintroducing and some won't. But let's remember to be kind and respectful for each other and support each other through what continues to be challenging time. So thank you, Sally, and all of the IPC team and everyone involved and all the colleagues who are supporting the reintroduction and supporting their colleagues too. I just want to read out a comment that's come through with regards, how we shared about we're always continually learning and improving as an organisation, and we've learnt a lot from COVID over the last 2 and a bit years, and hopefully that is helping us improve and how we respond in a timely manner. But there's just a comment around improvement being everybody's business. We all have a role and responsibility to improve in the areas that we're working in. And also just a reminder that there is support available to talk through ideas that people may have every Tuesday and Thursday afternoon, 1 o'clock and 4 o'clock is available of the improvement team. And then there's also on site at Newark every Wednesday, the Wednesday of each month. And that's the last Wednesday of each month. They're on site at Newark as well. And there'll also be support spread into our Mansfield community hospitals. And if anyone wants to get in touch with the improvement team with an idea, a thought, a suggestion, no matter how small, how big, give them a ring on 4347 or 4344. So just wanted to share that from a comment that's coming through, and thank you to colleague for recognising that. Rob, is there anything you'd like to close us off with relating to the strategy or other?
A couple of points, Emma, so thank you. Firstly, as I've touched on, this is a start of starting to socialise that document. I'm really proud and excited that the wider team attributed to the development of the strategy are coming through team brief over the next few weeks. So please look out for it, because there'll be a lot more detail shared. And the second point is just to reinforce what Emma shared about these are a set of suggestions, these are a set of actions. I recognise there's always more that can be done. So please do reach out. Those nuggets, so to speak, around improvement ideas will be invaluable. And my door's always open if people want to connect with me. Or if you want to just have a coffee at some point about exploring how you could contribute even further to making our strategy the best it could possibly be. So thank you, everybody.
Thank you. Thanks, Rob, and thank you everyone for being part of today's staff brief. Thank you for all the questions and the comments that have come through. I think it is important again just to say a massive thank you to everybody in the organisation. I do really recognise from being around in the areas that people continue to go above and beyond. We know that there's high demand on our services, and that's putting pressures. Please continue to take care of each other. We will do our utmost to look after you and take care of you as well. And again, have a voice and speak up if you don't think that's happening, because we want to keep improving as an organisation. But huge thank you to what you're all doing and delivering at the moment. And I say also a huge thank you to those who are working on site and those who are working flexibly in other bases as well, whether that's another site or whether that's from home. Everyone makes a difference to the care that we provide. So a huge thank you to everyone working across Sherwood at the moment. So I shall wrap up there, say thank you to all of the guests today. Some really important updates and news and insights. And equally, if anyone wants to get in touch with us, then I'm sure you know where we all are. I hope you do. All the contact information will be there. But please, I hope the rest of the week is kind to us, but keep supporting each other. And thank you very much, everyone. And I look forward to seeing you all again soon on a staff brief takeover, if Paul lets me again. But thanks ever so much, everyone, and have a good rest of your day. Take care. Thanks, everybody. Bye-bye.